Go.
Hello, my name is Erica, and I'd like to introduce you to my colleagues Bailey, Karen, and Alexander. Together, we are the Baker Consulting Company. Today, we would like to introduce you to our PACE program. We have implemented the PACE program in hopes of reducing infant and maternal mortality rates in non-Hispanic Black mothers, specifically in Milwaukee, Wisconsin. Today, we will discuss with you the background of Ann Baker's case, root causes, mission and values, support systems, operations, outcome, stakeholders, and the budget of our PACE program. We'd like you now to meet Ann Baker. She is a 34-year-old Black non-Hispanic woman. She has a husband, Charles, and 2 children. It is important to note that she has a family history of stroke, stress related to job, and hypertension. These were key issues missed in Ann Baker's case. Why weren't Ann Baker's concerns addressed? We believe Ann Baker's concerns were not addressed because there was a break in the continuity of care. Unfortunately, as in Ann Baker's case, and several clients like Ann Baker, the client is the only member of an interprofessional team that attends every physician appointment. We would like to bridge this gap with our PACE program to promote continuity of care throughout Ann Baker's case and mothers such as hers. Through research of Milwaukee, Wisconsin, we have discovered some background information we'd like to discuss with you. Discrimination, segregation, and implicit bias are all leading causes that lead to negative health outcomes in mothers such as Ann Baker and increase the infant and maternal mortality rates in Milwaukee, Wisconsin. It is important to note that non-Hispanic Black mothers are 3 times as likely to die from pregnancy-related causes than white women. Through root cause analysis of Ann Baker's case, we have identified 4 root causes: implicit bias, lack of access, lack of advocacy, and limited health literacy, all contributed to negative health outcomes such as loss of a newborn child and residual effects from preeclampsia. So I'd like to ask you guys today, as we present, please put yourself in Ann Baker's shoes. What would you have done if you lost your newborn child? What would you do if you're unable to care for your family because someone didn't listen to you and now you have residual effects from a stroke? So we have implemented the PACE program. The PACE program stands for Patient Client-Centered Care, Advocacy and Accessibility, Culturally Informed Care, and Education. The mission of our PACE program is to make Black non-Hispanic mothers the center of the patient care team in obstetric care in Milwaukee, Wisconsin. We also intend to educate physicians about implicit bias to promote a culturally informed environment. The values of our PACE program consist of culturally informed care, promotion of health literacy, patient client-centered care, accessible health care, client advocacy, and very importantly, unity. I would now like to pass it on to my colleague Bailey so she can discuss with you the 3 support systems of our PACE program.
So our PACE program consists of 3 main supports: education, accessibility, and advocacy. Each support was specifically designed in order to target the issues seen in our root cause analysis. The physician is the ultimate patient advocate. This is the motto that we keep at the forefront of our education efforts. So PACE education is divided into 3 separate sections. We provide current provider education, future provider education, and education for our clients. For our current providers, what we want to do is we want to host a training that focuses on culturally informed care as well as implicit bias. Implicit bias is attitudes or stereotypes that may affect the way you treat others, but in an unconscious manner. So our target population is the obstetric team at Ascension hospitals. What we will do is we will have this training where first we introduce what implicit bias is, have our providers take an implicit bias test, and we have chosen to use the implicit association test developed by Harvard and other institutes. Then, after they are aware of which implicit biases they may have, we want to introduce how we can put culturally informed care into every interaction with our clients. For our future providers, what we have done is partner with local colleges around the Milwaukee area. Our education manager will go in and provide guest lectures on topics similar to what we're providing to our current providers. We want our future providers to know what implicit bias is, as well as culturally informed care before they get into the work system. Next, we have education for our clients. When our client enters the PACE system, what we want them to do is they're paired immediately with an advocate tech. Our advocacy tech works hard to improve their health literacy. We want them to feel comfortable with the medical terminology they may be hearing throughout their appointments. The next part of education is we want them to be aware of the possible risk factors. These could be related to their race or family history. The next part of our program is accessibility. We believe all mothers of income or race should have easy, accessible health care. And we have done this in 2 ways. We have a proud partnership with the Family Foundation's home visiting program. What this is a specially trained nurse will go into the home of the mother alongside our advocacy tech. And what they will do is they will provide care in an environment where the mother feels most comfortable. Another side of this is our advocacy tech will show our clients different resources that are available to them. This could be different resources in different clinics around the area, as well as information and assistance with signing up for Medicaid. We also want them to know the many benefits of Medicaid, such as transportation to their appointments. The last and most important part is our advocacy part. As this is stated before, the mother was the only part of the interdisciplinary team that was at every single appointment. Our advocacy techs work to bridge that gap. What they do is they attend home health care appointments, as well as outpatient visits, all the way through to inpatient and delivery. This way, there is no break in care at all. They are there to provide support for our clients, but also make sure that their concerns are not only heard, but addressed by the providers. Think of Ann Baker had an advocacy tech. Her concerns for stress and high blood pressure would have been addressed immediately, therefore not resulting in negative health outcomes. Overall, the PACE program is a 3-pronged approach. We focus on education, advocacy, and accessibility while all keeping our client at the center of our attention. I will now be passing it off to Karen, who will discuss operations. I will now be discussing PACE operations. Throughout my section of the presentation, I would like you to keep in mind that our employees are bridging gaps that we saw in Ann Baker's care, that we saw in home, in the doctor, and throughout the community. I will be walking you through our PACE program proposal by showing you what a typical client's experience would look like in the PACE program, starting off at our pregnancy centers. These are pregnancy centers that are already existing throughout Milwaukee. They provide free pregnancy test screenings for women of Milwaukee. Pregnancy center employees will be discussing the services that we provide to clients and also asking them if they would like for one of our employees to be reaching out to them. If the client agrees, then one of our outreach techs will be following up with them. They'll be calling them over the phone and providing additional information for the client, as well as setting them up with a meeting with one of our advocacy techs. This meeting will be held at Ascension St. Mary's Clinic, where we have our office. This initial meeting will be covering background information with the client, as well as setting up home health visits. They'll be discussing at home health visits what the desires for the client's pregnancy, as well as anything that they would like to bring up at their next OB visit. During these home health visits, we will be partnering with the Nurse Family Foundation that will be doing routine checkups. Our advocacy tech would be available to come to any and all OB visits with the client. During these OB visits, the advocacy tech will be able to voice any concerns that the client may have. And they'll provide a voice and ensure that the provider is addressing all of their concerns. Throughout their 9 months during the pregnancy, our advocacy tech will attend many meetings, and we believe our clients and advocacy techs will build a bond. And our advocacy tech would be available during labor and delivery for our client. They'd be able to voice when a client is in a very sensitive time. And after labor and delivery, our advocacy tech will be following up with our client to ensure that we've met all their needs, as well as asking if they have any suggestions that we can implement into our program for the future. I'll now be diving in a little bit deeper about our PACE program operations, starting out with our outreach techs. As I discussed before, they're the first point of contact for our company, as well as they're the ones that are calling the clients to after we have received their consent, as well as receiving calls from any of our marketing efforts. And for advocacy techs, they have a community health worker training program that they must complete before being hired on. This is a 100-hour training program that provides background on public health, health promotion and maintenance, chronic disease prevention, as well as self-care. And for our education manager, they're the ones that are providing the implicit bias training for our ascension physicians, as well as future providers at local area colleges, such as Marquette University. And for our ascension liaison manager, they're the ones that are overseeing all of our advocacy tests. They are providing continuous education, as well as ensuring that we are evenly reaching the entire city of Milwaukee. And most importantly, we have our PACE physician champion. They're the ones that provide us with the credibility when working alongside physicians. They provide leadership and expertise in advocacy and culturally informed care. We're going to be partnering with the Association of Black Women Physicians to elect our champion. For example, Dr. Amy Swift Johnson, that is located just outside Milwaukee, would be a great candidate for this position. I'll now be discussing our desired outcomes for all of our efforts in education, advocacy, and accessibility. For starters, we are wanting physicians to be aware of their implicit biases and have ways to mitigate their effects. Next, we want our physicians to be educated on what culturally informed care looks like and how to implement that into their practice. And we also want to improve our clients' health literacy so that they may self-advocate for themselves in the future. Next, we have our advocacy. We want our clients' concerns to be acknowledged and addressed by providers regardless of their race. And lastly, we have accessibility. We want to improve knowledge and access of quality care. And we want to eliminate any risk factors so that we may have the best health outcomes for our clients. I will now be passing it off to Alexander, who will be discussing finance.
Wonderful. We're going to be starting with our performance metrics. This is how we're going to determine if the PACE program is effective in our targeted community. Over the first 5 years of implementation, we're going to be looking at the infant mortality rate for Black non-Hispanic mothers. Currently in Wisconsin, the infant mortality rate for Black non-Hispanic mothers is 14.4 out of 1,000 live births. This is almost 3 times as high as our 5.2 we see for white non-Hispanic mothers. We believe with the implementation of the PACE program, we can reduce that infant mortality rate from 14.4 down to 11.0, which is our national average for infant mortality rates for Black non-Hispanic women. Next, we're going to be looking at our stakeholders and partnerships. We do have community, hospital, provider, and university partners. Our community partnerships are, of course, the pregnancy centers. Those are our first point of contact for many of our potential and new clients. And then we have our Ascension Columbia St. Mary's Women's Medical Center. This is where we're actually going to be located. Ascension, being a nonprofit organization, has been willing to help us find a place to stay, as well as ensure that we have some funding through them. Then we have the Wisconsin Department of Health. They're going to be our point of access for the Title V funding for the state of Wisconsin. And finally, for our community partners, we have the Black Health Coalition of Wisconsin. This coalition is going to ensure that we're effectively reaching our target community. Next, we have our hospital. Of course, we're providing education for the Ascension network, and they will be accessing some healthcare funding for us as well. And then we have our providers. We are partnering again with the Association of Black Women Physicians. This being a nationwide organization, we can find a champion easily wherever we are located. Currently, in Wisconsin, we do have the Association of Black Women Physicians providing us with the physician champion. The physician champion, of course, giving us a lot of our backing for our education that we will be providing. And finally, we have the Family Foundation Home Visiting Program. This program is going to be allowing us access to some home health nurses upon our client's request. And finally, we have our universities. We'll be partnering with the University of Wisconsin-Milwaukee as well as Marquette University to ensure not just educating our current providers, but future providers as well, and keeping the PACE program well and alive. Next, we're going to move into our income. We do have that Ascension partnership. Partnering with them grants us access to $100,000 for the first 2 years of implementation of the PACE program. We do have some other grants that we have been looking at. These are more for when we expand past what we're currently looking at, as well as any unexpected growth. The majority of our funding is going to be provided by the Title V Maternal and Child Health Block Service Program. This program works for every $3 the state provides, the government will provide $4, resulting in quite a sum of money. Wisconsin, on average, has been making over $10 million in grant funding. The PACE program will be accepting $1 million with a 5% increase. This 5% increase is, of course, to cover our known growth we're expecting within the first 5 years of implementation. Now we're going to be looking at our marketing. We will be having billboards that are going to be large but not terribly informative. We will be at the yearly state fair. The state fair is a wonderful way to connect with the community. We will have an outreach tech provided there to make sure that we can answer any questions as well as set up appointments for our potential new clients. We also believe that the state fair will be a wonderful place to accept donations and eventually start a silent auction as well to continue the PACE program in the future. Next, we do have our paper marketing. Paper marketing is going to be accessible at any point of access, including our state fair. It's going to be highly informational, give a little bit more background of the PACE program, you can find us, and different ways to reach out to us. And finally, we will have social media as well as our app. Our app is going to be the way our current clients connect with their specific advocacy tech. They'll be able to let the tech know what kind of programs we have available for them, set up home health visits, as well as letting the tech know what will be appointments they would like to have an advocacy tech at. And with our social media, we will be having a Twitter, an Instagram, and Facebook, as well as our email. This is a wonderful way to react with the community, get some feedback from the community, and if we'd like to reach out beyond the scope of Wisconsin, we can do so with ease. Next, we're going to be looking at our proposed budget over the coming 5 years. Some points of interest is our HIPAA compliance as well as security. We will be working directly with some sensitive patient information and are going to need to be HIPAA compliant. This is a training for all of our employees as well as any devices we use to be secured through a HIPAA compliant security system. We do also see that we are growing, being a nonprofit organization and partnering with nonprofit organizations. Any growth that we do see will be built back into the funding for the future coming years. This is to keep us viable, not just through the 5 years we have shown, but beyond that as well. Another simpler way to look at this is with our graph. Our graph does take into account that 5% increase each year. It does show that we're not just viable for the first 5 years, but coming years as well. We will stay viable, and we will be able to reach into any other grants on a need-to-be basis. Finally, I would like to look again at our root causes and how we've addressed each of these throughout our presentation, starting with our limited health literacy. Again, we do have the advocacy tech that will be providing some education for the clients, letting them know what kind of health literacy terms they may be running into throughout their pregnancy. We do have the lack of advocacy. We're addressing that, of course, with our advocacy tech, this being one of the main points of our program. We do have a lack of access. Through that, we do have some resources like the home health visitation program that will allow clients to be able to reach healthcare professionals in their own home. We will also be able to show them other places that they can find resources in their community already. Finally, we have the implicit bias. The implicit bias, of course, being addressed by the education that we'll provide to not just our current providers, but future providers as well, to ensure that they know what culturally informed care is, and to make sure that they provide culturally informed care. This, in all, turns our negative health outcomes into positive health outcomes. Finally, let's talk about Ann Baker. And had Ann Baker had an advocacy tech, there would have been a continuing stream of care, there would have been any breaks in communication between providers and patients, and overall, we would have seen a much more positive healthcare outcome. I would now like to thank you for your time and open up for questions.
First of all, I have an opinion. I have two. I like your suits. And secondly, awesome presentation. You all seem to have covered quite a bit. My piece of it, I do defer to these professionals to the left of me, but my piece of it is what inspired you to start this Baker Consulting Company?
What inspired us to start this Baker Consulting Company is that we recognize in Milwaukee, Wisconsin, that this is such a great issue. And we all put ourselves in Ann Baker's shoes when we're going through this case. Mm-hmm. And I'm actually currently pregnant right now, so I asked myself, what would have happened if my baby would have died because my obstetric physician didn't listen? I would be heartbroken. And so it is very important to understand that other women are at greater risk of this due to race and even where they're living at.
So I just thought it would be a great program to start and possibly have an advocate, because I know that I would sometimes like to have someone come speak for me, because in healthcare, it moves very fast. And that's just the United States for you. But if we can add an advocacy tech to kind of bridge some of those gaps, then I think it can promote wonderful outcomes in the African American population.
Do I have one more? Go ahead. No, go ahead. Do I have one more response?
Oh, okay.
Yeah.
Yes, I wanted to touch on that as well. So over 90% of the healthcare failures that we have in the United States are due to a lack of communication. There's a wonderful story that we've all, I'm sure, heard of the surgeon operating on the wrong leg because they were not told where to operate. There's simple markings, and something as simple as just marking the wrong leg can lead to a lifelong journey of trying to recover. We believe that had there been an advocacy tech, not just for this, not just for Ann Baker's case, but in general cases as well, we wouldn't have issues like that. They would have been addressed because, no, I've been there that entire time. I realized what leg has been there because I was there the first time that they entered our care. So we would have been able to stop anything like that from happening because we have one point of contact throughout the entirety of the healthcare system.
Thank you. Thank you.
Excellent presentation. I was wondering, I love that you included not just current providers, but building into the training of future providers. Can you talk just very briefly about what you envision that looking like?
Yeah, I can do that.
Sorry. I'll probably do this best.
Yeah, so we just think it's important that our future providers are aware of this. And what this looks like, so we briefly kind of talked about our education manager, and what they would do is they would go into those local colleges and provide guest lectures, is how we envisioned it. So guest lectures, they come in maybe once a semester or twice just to touch on these topics so that before they enter the healthcare system, they're aware that they might have these implicit biases, but there are ways to, work through them with culturally informed care. So that was the question. Thank you. And during these guest lectures, they're going to be doing implicit bias tests. So that way they are aware of what implicit biases they have. And that's through the Harvard Association test. And the way that the test works is that they have pictures of an African American and a white individual, and the person would have to associate negative words or positive words with those pictures. And it also takes into consideration how fast you're doing those associations. So that's the way we would be doing the implicit bias. But they also want to give information on how to incorporate culturally informed care into their trainings.
I have a question about your financing. As you're going through, you mentioned the block grant, and after the Ascension funding went out year 2, then you're pretty heavily depending on the block grant format. So my question is, what's the sustainability if that pattern changed or you didn't get some of the grant monies that you anticipated?
Absolutely. So we do hope that we do get the majority of the Title V funding. We do have some other grants that we believe we will be able to access because they do deal with maternal and child health. And those are other funding grants through the government. If we're not able to do that, we are also hoping to look into eventually taking donations and relying heavily on partnerships with other outside sources as well.
You might even show them that slide so we can show them the specific grants we had also looked into.
May I?
Just a clicker.
I apologize. Thank you so much. I apologize for that one.
But yeah, we just kind of like to use that as a safety net in case the Title V block funding didn't work out for us. Or even like he said, if we expand too quickly, we can always apply for these grants as well and make sure that we can reach more than our target population.
As you do see, we do have some free grants that we've been looking at. Each of these are able to cover us for at least a year, some more than that. In your individual package as well, there's a further breakdown on the different finance sections. And you can see where we do increase. We are expecting a 5% increase overall from year to year. That is the 5% increase we're hoping to get from the Title V. We we're able to do this, as well as accepting donations.
I have a question. Love the presentation. How do you receive your clients? How are clients referred to the PACE program?
Absolutely.
So we have partnerships with pregnancy centers that are already located inside of Milwaukee.
Okay.
And they provide a free pregnancy test screening, and then the employees at their visits are going to be talking to the clients, letting them know what our program is, and asking them if they want someone from our organization to reach out to them.
And I'd like to touch on that as well. That idea had kind of sourced from, there's a KU study typically right now going on for e-moms. And so at my obstetric appointments, I was giving information about that. And then I was made aware that I'm able to participate in that. And then after I had agreed that they could contact me and I gave my okay for them to contact me, they called me and we set up an appointment and then also got me set on the program. So I just thought that was so great because I would have never known about it throughout the community. Maybe I'll see it at the state fair. Hopefully I'd want to participate in it at the state fair. But having my physician talk to me about what it is and why it would be beneficial to me really helped me decide I do want to participate in this. So that's kind of what we're hoping for our PACE program. And then, like we said, we have an app. So once mothers like me start talking to their friends and sharing our platform, then we hope that will expand. But right now, we have we've just accounted for what we will know for right now. So something else that we would like to add is that this is not just specific to non-Hispanic Black mothers. If we went to, say, a different area where there was a higher Asian population that were experiencing health disparities, an advocate might also solve their problems. So that's where we want to start in Milwaukee, but this can go so much farther.
I'd like to touch on that as well. Of course, we are hoping that the potential new clients are coming from those pregnancy centers, but we are aware of HIPAA compliancy. That's why we're making sure that the pregnancy centers let them know about our organization, exactly what we do, and making sure that we get their approval to reach out for them to keep us HIPAA compliant.
Thank you. I just wanted to say congratulations on your pregnancy.
Yeah.
Congratulations and best to you. You have a question? Sure. Go ahead.
One more minute.
Yeah.
Great presentation. So as you probably found in your research, over half of pregnancies are unplanned in the U.S. So did you look at that in Milwaukee? Do they have the same rate? And do you have a plan to address other health issues of women, such as reproductive health?
We have not yet, but hopefully with expansion, we'll be able to touch on some more information such as that.
You touched on when you started and you gave your root causes analysis, unity was the last one, but I didn't hear unity after that. So how does unity factor into
So that's where the patient-centered care model comes in. We probably should have described that a little bit better. But in a patient-centered care model, we're in one team, and everyone works in unity to provide the same care to that patient despite race or culture. So I thought unity should be included in there. We probably should have touched on that a little bit more throughout the presentation. But the patient needs to be at the center. And even through Ann Baker's case, unfortunately, they had team-centered care models. And that is where a lot of problems source from. So and not even in obstetric care, but in all care, we need to be permanent. All need to be together.
Thank you.